Thank you.
Okay. Thank you, Dr. Xu. So there are all pros and cons for the every setting. So actually, we are not very late for the schedule because our 11:20 speaker, Dr. Han Xu, so he's not feeling well, he's not coming, so we're a little bit late. So our next speaker is Dr. Huijuan Liao. She's going to discuss about the pros and cons in academic setting. Dr. Liao graduated from Jiangxi Medical College in China, and she completed residency training in New York Presbyterian Queens, and she completed a fellowship in endocrinology, NYU Winter. And currently, she is practicing endocrinology in Nassau University Medical Center, and she serves as a core faculty member and at the Nassau University Medical Center. Let's welcome Dr. Liao to discuss in academic setting. Thank you.
Thank you, Dr. Zhu, and thank you, ACP, inviting me for this topic. I would like to let you guys know, many years ago, I was like you guys coming to this event, and when I went to my residency, I still continue coming, and in my fellowship, I also come to this, we call CDC Career Development Conference. I have to say, I benefit a lot from this event, and I make friends. I know Dr. Zhu from this ACAP meeting, and also I meet multiple attendants. They really inspired me and give me lots of good advice for my own career. I would like to thank you for this organization for my own personal career. Let's start my talk. Okay, what to consider about academic setting? Now I'm in academic settings in Nassau University Medical Center. We have a internal medicine training program, about 40 residents every year, including preliminary and categorical. And also, I'm the core faculty of the endocrine fellowship training program. We do recruit fellows, 2 fellows and 1 fellows alternate. Like we have 3 fellows in total. Okay. First of all, I put this slides because to be honest, I found this online as the definition of academic medical practice. Just take 1 minute to look at the slides. You will. Why I put this slides? Because I feel like kind of, those fancy words and abstract and sounds very advanced. But I would like if you practice in academic setting, you will hear a lot about those things. Those are the puzzle words. Today, my job is going to explain this and use very common language you guys can understand straightforward to explain. Okay. Doing academic practice, you may have more variety in your role. Of course, we see patient, you as a clinician seeing patients every day, not necessarily every day. Later I'll mention more about that. And you will be an educator. You're training the residents, training the fellows, training medical students. You have to be a good role model, and you are their mentor. And also you have opportunity to do research, including clinical research, bench work, we call basic science research, or translational research. In terms of how they will evaluate you as a faculty member, here, as Dr. Kong mentioned, publication. That's the main parameters they evaluate you in academic setting. When we talk about publications, it includes peer-reviewed PubMed index publication. Like when you guys applying for residency, they put you, they have to ask you guys to put those PMID number. Those means is Medline index publications, and also some non-public Med index peer-reviewed article. And last is non-peer-reviewed publications, which include editorials, online magazines, or some, sometimes actually you can publish in New England Journal of Medicine and some comments that count as non-peered publication. And of course, writing the board exam questions, usually those experts, Of course, you have to attend the conference, like conference presentations. You submit abstracts when accepted. It could be either oral presentation or poster in all kinds of meetings, like international meeting, national, state, like the New York or regional meeting. For example, when we talk about the regional meeting, you guys may know we have ACP. We do have the local ACP, like we have ACP New York chapters. Same thing, like all kinds of different professional society. They may have the national one. They may also have some local one. Like another one is like my institution is in Long Island. Like we do have the every quarter conference, the endocrine conference, as we call regional meeting. And also when you doing academic, you do presentations kind of often, for example, you give ground round including the hospital ground round and internal medicine ground round. In my own specialty, like endocrinology, we also have ground round. And also sometimes you might be invited to give the presentation to the other professionals. Like sometimes the Department of Nurse might invite you to talk something, or sometimes the satellite clinic invite you to talk about something. Yeah, it also counts as the scholarly activity. Building the formal courses, I would say this part, you guys being the resident or the fellow might not be so familiar, because that's the job for the program. Like you create the curriculum and you create the evaluation tools. You do some didactic educational activities, like you create the simulation modules, preparing for those educational materials. Basically, those are things done by the core faculty member. And the other thing is you're going to be responsible for some seminars, conference series. In that situation, you will be the hoster, which means you invite people from the other institution to give the topics. You being the hoster. And the last thing I put in my slides is, develop those training modules for medical students, resident fellows, or sometimes for nurse. Like in terms of in the hospital, they want to improve the patient safety. For example, when hypoglycemia, being the faculty member in endocrinology, I might, building a module, cooperate with the IT department, like all the persons, the nurses, students, residents, they have to finish that module, those kind of things, Okay, other scholarly activity are writing chapters in textbook, writing grants, the grant leadership, like you are the PI or co-PI, and also the leadership roles, like you are the board committee member of some, of some government boards, or in your, your hospital committee. We have all kinds of committees in a hospital, like IRB committees, patient safety committee, and lot of things, and also besides the publication, if you are invited by some journal to be a reviewer, that also counts as the scholarly activity. Okay. Practicing academic, you may enjoy a more flexible schedule because you can get assistance with some of the workload, especially like if you if you have the grant to support your salary, you don't have to 100% to see the patient. Depends. I know some faculty, they have very good grant support. They only need to see the patient like 1 day a week. Okay. If you don't have the grant support, you see patients, you educate the resident, you educate fellows. Sometimes they give you different like percentage. Yeah. That brings about the cons. If you cannot get grant support, you have to devote all the time to the patient care or education. And also, you being an educator, you're going to be evaluated by the resident, by the medical student, or by the fellows. If you're not doing a good job, you may lose this opportunity, which means you may have to see the patient 100%. Yes, very tough. And also, as we all know, you guys being the resident, being the fellows, you guys do the first call. We attending just as the second call. You guys write all the notes, HMP, progress notes. We the attending have to sign the note. Well, it looks like, yeah, we do not have to do all those routine things, but don't think that way. We've been attending, just click the notes, just sign it. Of course, every time, we still have to read your note, have to make some correction, or have to review the prescription you sent, because if anything bad happens, especially, for the junior resident, junior fellows, sometimes they do make mistakes. Human make mistakes. If bad things happen, we've been attending, also take the responsibility. Of course, compared with Dr. Xu, Dr. Zhu, my salary is much less than theirs. In academic, the model for the pay is usually base salary and bonus. Like in my position, 30% of my salary is the base salary, and 30% is bonus. Bonus is from the productivities, like using the patient, yeah. So it could, end up with, you do the same amount of the work compared with the private practice, but your pay is much less. Yeah, but good thing is there's a potential increase in salary as your RVU increases. What is RVU? It's relative value unit. That they count as the productivity, like dollars for each RVU. It could change. Yeah, and also good things is kind of your safety, because when we retire, we do have pension, but we have to contribute. Like now I'm the tier 6 in the pension plan, which means I have to contribute 6% of my income to the pension for the future. If I retire, I get a pension. But if you practice, you joined a very, very long time ago, like they've been working for like 20 years, 30 years, they're the top, like tier 1, they don't have to contribute anything. But nowadays, recently joined, you have to contribute some to get pension. Well, I would say it's a different way to make a difference in medicine. Like we practice academic, you have to be very, very familiar with those guidelines. All the knowledge you have to up to date. Why? Because you are training the fellows, you are training the residents, and also you have to teach them a lot of things like the ACAP required, like teaching them how to maintain good interpersonal communication skills, how to learn system-based learning, how to learn practice-based learning, all those things. You have to be a good role model, because whatever you are doing now, it might impact the next generation of healthcare care provider. And also in academic, you do have the opportunity to conduct research, to get involved in some clinical trials. I'm going to give you an example. Many years ago, I think maybe 10 years ago, those TKI medication treating for medullary thyroid cancer has not been listed as the guideline. Like currently, in guideline, there are strong evidence we use TKI for medullary thyroid cancer recurrence. But at that time, 10 years ago, it's still in the clinical trial phase. One of my patients, she's from Peru. She had a very bad surgery and have some tumor residual left, and also has recurrency. Her endocrinologist at Peru just told her, go to US. There they can take care of everything. Okay, patient come to US. Patient is undocumented. Has no insurance. Of course, no private setting will accept her. All the private endocrinologists just turn her away. They, we are the safety net hospital, public hospital. We have to take care of those patients. Okay, so we took her and we contact the drug company to, to support the medication for her, because, they do have clinical trials, can support this patient, even though this clinical trial now finished, we get very firm data. They're still supporting our patient to get free medication, TKI, those are kind of, expensive. So you do have the opportunity, to, hook up patients with clinical trial to help the people, even those, most vulnerable people, Okay, in terms of independence, or we call autonomy of decision making, it's very obvious. Like if you do private practice, you are the boss. You are the boss. You can make all kinds of decisions by yourself. You have greater voice in whom you want to hire, who you want to fire, and you can set up your clinic, set up your schedule. You can take time off, whenever you want, and you can decide how many patients you want to see. However, like me, I can't, everybody here might still remember 2020 when COVID hit really bad in New York. All the outpatient closed. I'm an endocrinologist, our outpatient also closed. At that time, Department of Medicine required me to go to the inpatient to work as a hospitalist. I have to do that, Yeah, the thing is, very tough for me because, since I graduated, I never practiced the medicine. I just do my own specialty endocrinology. It's kind of stress, but I have no choice. I have to go there. Otherwise, I will lose the job. Yeah, I still remember at the time, the COVID hit very bad. In my team, I have the GI fellows working as my senior residents. I have residents from orthopedics to work as the junior resident. Orthopedics resident, they never touch stethoscope. Yeah, and also I have pediatric residents come work as my junior resident. When they place the order for Tylenol, they will need to double check with you. Is this dose too much? I said, no, this is adult people. And also, I have psychiatry resident come for help. Even though he's the psychiatry fellow, but in my team, he has to do the intern work. You can imagine those, stress. Yeah. Just want to let you know, I have no choice. I cannot, say no. And also, I think in academics, I'm not sure for the other institution, but in my institution, all the specialists, they have to double certified, which means like I have to be board certified. I have to, renew my internal medicine board every 10 years, and also renew my own endocrinology board. I know if you are, private practice, you don't have to, do those, unless if you want, you just only needs to maintain your own specialty board. That's different. Yeah. Okay, this I think is my last slide. Factors to consider. Compensation is a big part, and also if you're going to go to institution, be better know their culture to make sure you fit their culture. And also you have to consider the opportunity for your own career growth. Most important is you'd like to choose a place you will be happy to work and to live. Thank you.
Thank you. Any question? One interest in academic? Okay, thank you, Dr. Liao. So we're a little bit behind the schedule. So next, as we said, one speaker was not feeling well, so did not come here. So next, actually, our ACAP, this career development.